Before we get started, please remember this podcast is for general educational purposes only. We're not providing medical advice, diagnosis, or treatment. Always consult your own healthcare provider about your care. Welcome to Fertility Nurses Unfiltered. 2 nurses, 1 mic, no bullshit.
I'm Ashley LaRue, fertility nurse and founder of Fertility.
And I'm Laura Wepler, fertility nurse and founder of Navigating Fertility with Laura.
You got questions, the internet has a lot of opinions, but what you really need is 2 fertility nurses who aren't afraid to tell the truth.
No scripts, no sugarcoating, just honest, evidence-based nurse-to-nurse conversation. So let's get into it.
Hey everyone, welcome back to this week's episode of Fertility Nurses Unfiltered. As always, Laura and I are super excited to be with you this week, and we're really excited about today's topic. This has been a long time coming. We are going to be talking about integrative medicine, specifically acupuncture, Eastern versus Western medicine. How do we combine those two together to give the best patient experience possible? All the things. Really excited to have this conversation today. And when we were planning this podcast episode, really couldn't think of anybody better and somebody I absolutely wanted to get on here. So I'm super thankful to Dr. Mary Sabo for being with us today. Just really quickly, Dr. Mary Sabo and I worked together in my past life when I was working at the fertility clinic. I saw firsthand her seeing patients at the fertility clinic I worked at CCRM New York. She still does transfer acupuncture for their clinic today. And she's just a wonderful human, and really wanted to have her on here because she just does such an amazing job of Eastern versus Western medicine, combining the two, evidence-based practice and research. So really excited to have her on today, and I need to do your bio for better than what I just did, but I wanted to throw that in there that I do know her personally, and she's just an awesome human. So Dr. Mary Sabo is a doctor of acupuncture and Chinese medicine and the founder of Lillian Horn, an integrative wellness practice in New York City that has helped support thousands of conceptions. She's been practicing since 2007 and specializes in reproductive health, working side by side with physicians and REIs to give fertility patients the best of both worlds. And just one example, like I mentioned, she does go into CCRM New York office on embryo transfer days to support patients on site, which tells you everything about the level of trust she's built with the medical community there. Mary has co-authored published research on complementary medicine, trained in cancer supportive care at Memorial Sloan Kettering, and has been featured across national platforms including Fertility IQ, Mind Body Green, and Motherly. She lectures regularly alongside reproductive endocrinologists to educate and empower women on their fertility health. And maybe most powerfully, she used her own integrative approach to conceive her son at 43 using eggs she had frozen at 38. So she comes with a personal and professional experience. Mary, thank you so much for being with us today.
Thank you for having me. I'm super thrilled to be here.
So let's kick things off the way we always do. And Mary, why don't you tell us just a little bit about, obviously you've had a very long, successful career. How did you get to where you are? We'd love to hear building Lillian Horn. And then if you want to weave in some of your personal, whatever you're willing to share with our listeners, that'd be great.
Yeah. I mean, I have a 20-year story, so I'll try to make it brief. I was pre-med in undergrad, so I always wanted to go into medicine. I've always loved Western medicine. I decided to pursue Chinese medicine because I was into Eastern philosophy, and I really liked the collaborative approach between patient and doctor in Chinese medicine, where it's like you meet with your acupuncturist every week to work on improving whatever it is you're working on, whether it's back pain or headaches or insomnia, in my case, fertility, reproductive health. And I was really intrigued by that. That's not really how our medical system works. I really wanted to be a participant in helping patients improve their quality of life and their health through whatever it is they're working on. And so I chose Chinese medicine so that I could be more involved with that. But I always intended to go to medical school. I really wanted to have patients have access to both and to use both and not have to pick one or the other. That's always been my intention. But I went to a 4-year master's program for acupuncture and then did an additional doctorate program. And I was just kind of like, yeah, I'm done with school for a bit. So Chinese medical theory is very abstract. We talk in terms of qi and blood and yin and yang, and this is how you learn the medicine and the theory to make the tools work. Our tools are acupuncture, Chinese herbs, supplements, customized diet suggestions, lifestyle changes, and anything else. I use, supplements now. Those aren't Chinese medicine, but anything targeted like that has some evidence based. But the Chinese medical theory was so abstract for me, and I had already had a big foundation of Western medicine that I honestly got a little bit frustrated. I think it's easier to come to Chinese medicine when you know nothing of the body, but I already had such a strong framework of understanding how the body worked, and I loved knowing that knowledge. And so I found Chinese medicine a bit frustrating at first, but the female reproductive, like our menstrual cycle, made perfect sense to me in Chinese medicine. The way the blood and yin convert into yang, and the movement of qi, and these are all terms, obviously in Chinese medicine that we use, but I don't speak that way to patients, and we'll get into that later. But it was my entry point into helping patients, especially women, when I first started practicing. And if I could understand how a woman's menstrual system or menstrual cycle was operating, I could fix anything. Migraines, IBS, insomnia, mood. And so it really became my entry point for treating patients if they weren't on the pill. When a woman's on the pill, it kind of, disrupts the way the brain and ovaries are communicating.
Yeah.
But if I could have that information and we could track the changes, how I could influence the menstrual cycle health, I could impact anything in the body. And so that was really my entry point, and how I got really good at treating the fertility then, especially natural fertility. If you can really regulate a menstrual cycle and take away menstrual cramps and, we call balancing hormones, but really just optimizing ovarian function and blood flow to those reproductive organs, anything other than male factor, you can really improve fertility naturally, and then also support IVF outcomes. So that was the launch of my career. That was 20 years ago. But about 10 years in, I decided to freeze my eggs. I don't know if you guys dated in New York City, but it's not far off from Sex in the City, I will say.
That was the first thing that came to my mind when you said dated in New York City. I was like, Sex in the City?
It really, I dated in Chicago too, and it was like nice. But here I was like, okay, they weren't joking. Those writers from New York, from Sex in the City. So it took me a bit to find the right man, and I found him at 38. So I froze a batch of eggs at 36, where retrospect, I would have, I tell my patients to freeze sooner than that if they can. But I froze a batch at 36 and again at 38. And that was a month after I met my husband. This could be a whole nother podcast about egg freezing. And I went through my own experience with egg retrievals, which I really geeked out about because I loved the process, and I had already helped thousands of women through it. And I just thought it was so interesting being on the other side. However, when I went to get pregnant, was less enjoyable, I gotta say. And we should talk about that too. But so about 15 years into my career is when I tried to get pregnant, and I did end up using my frozen eggs. I was 42 at the time. And I'm so grateful that I had the, knowledge and confidence and resources to freeze those eggs, because that's ultimately how I had my son. And he's almost 3 now, and he is a delight. I wish I could have like 8 more, but I'm very grateful that I have him. And I'm very grateful that I waited to find the right partner. And that we can, do things like freeze our eggs and ensure fertility later in life because of it.
Yeah. I love going back to what you said about like, it's almost easier to go into Eastern medicine if you don't know anything about Western medicine. But I love that you had that background and then you were able to kind of tie that in to what you're doing with acupuncture and Eastern medicine. I imagine that it sounds like that was maybe a little bit difficult at first. And I think, from a Western medicine perspective, I think it is hard to wrap your mind around Eastern medicine. And that's why we have this divide, right, within the medical community of one versus the other. But it really does need to be a bringing together.
I agree. I have always thought Western medicine is so powerful. When I lecture a lot with reproductive endocrinologists, like you said, and I like to present Western medicine is really good at kind of doing the body's job for it when it's not doing a great job. But Eastern medicine is really good at figuring out why the body's not doing a great job and trying to help it come into homeostasis faster. But sometimes it can't do it, like as we age, our egg quality declines. And there are ways that we can optimize what's there, but we can't turn back the clock. And that's where I think IVF is such an incredible tool to try to harvest, as many eggs as possible and find the good ones. And I use my tools to try to optimize what's there and try to get more healthy eggs if possible. But the two together are really good. But I think there's also a lot of ego in medicine. And that's where we're getting this divide, I think, of, if you're an acupuncturist and you help, let's say even like 10 cases of women get pregnant where they were struggling even with IVF, you think you're the cat's pajamas and that you think you know way more than doctors. And then it just kind of self-feeds that process then. Or, if you see a wellness practitioner speaking like that as a physician, you're like, oh my gosh, right? There's no evidence. It's all anecdotal. And I think it's harming patients the most of what's better, which one should I use? And that's not the conversation we should be having. The conversation we should be having is when to use what and how to create a cohesive team that works together and trusts each other to help you navigate with less stress and help you reach your goals faster.
Yeah, absolutely. And I love a part of your story is that, you originally thought you were going to go to med school. I was the same way. I was pre-med in my undergrad. I had to go back to nursing school because I thought I was going to go into medicine. But I took some time off and I actually started working with patients. I was working in a hospital. And I was like, I want to be in front of the patients more. Like you said, like in Eastern medicine, you get to see them on a weekly basis, sometimes potentially more. So you just get to know the patient a little bit more, have those conversations. You just have that relationship that maybe, yes, there's some wonderful physicians, MDs that are able to create that, but you're not seeing the doctor quite so much. You're not having those conversations. It's not that supportive. So that's why I switched to nursing I want to be more at the bedside. I want to build more of that relationship with my patients versus being the physician. I love medicine. I love what the doctors are doing. I agree with you 1,000%. But there's that piece of like what fills your cup. And I can imagine going into Eastern medicine for you is very similarly going into nursing for me. So I love that piece of it too. And I think all of this shaped you. And I know I say this, but you do such a good job of that Eastern Western medicine meld and having those conversations and just being open and transparent of like, yep, I helped here, they helped here, and we can work together to support patients. It does not have to be this sort of divide, but I think you having that sort of background and history and passion has, fed into that 20-year career for you so well. And I think more people need to be having these conversations and being open to being like, yeah, we can both work together.
Yeah, well, I think that speaks too to what Ashley and I have talked about a lot on the podcast, which is we all are experts in our respective areas. It is not possible for us to know every single angle of medicine, right? Eastern, Western, nursing, acupuncture, physician, right? It's not possible. So we all, if we work together and we collaborate and share knowledge, like that's what's going to get our patients the best outcomes.
And they feel way more supported when we do that, by the way. Like I did a survey actually with another IVF clinic early on in my career in New York that overwhelmingly patients who had a doctor and acupuncturist who were communicating, their stress levels were lower, their relationship quality was better, they were sleeping better. Across the board, they just had a better quality of life throughout the whole process. And so, yes, we're all focused on outcomes, but sometimes getting there can be, it can either be lots of suffering and angst and anguish, or it can be, learning and growing and building resilience. And, even I like my work. I like doing this particular work because people are so willing to make changes. Often, the choices we're making in our lives of what's going in and on our bodies focused on the shape we want our bodies to be, or whatever's convenient, or whatever fad we think is good right now. But when women struggle to conceive, they are open and vulnerable, which can be a bad thing too for misinformation. But getting the right advice and support can be transformational. And, we end up helping patients figure out the optimal diet for them and, reducing IBS symptoms or improving sleep quality, or, getting rid of menstrual cramps they've had their whole adult life, or, multiple things like that, where it's just along the way with the right uh, care team and advice, it can be transformative. It's not usually pleasant. It's like the silver lining no one wants when you're
Yeah.
struggling and you end up, feeling better than you ever thought. But really you want a baby. But, those are some silver linings that I think happen when we're all working together and caring for patients.
No, absolutely. I think I mentioned this on the podcast previously, but I did see some statistic or quote or something that literally said I would have taken, for a better experience during my journey, I would have taken longer to get to the overall outcome versus having a terrible experience but getting my outcome in a shorter time period. And I just feel like that really speaks to it, of what you're talking about, is having whatever that support system is around you, your acupuncture, your coach, your therapist, the doctor, like having this team of sort of that integrative medicine approach. You're going to have a better experience during the process and not feel so overwhelmed and not potentially have as many symptoms, or, all these, like, just supporting the whole body during the process. And I just felt like that was really powerful and speaks to what you're talking about, is like the experience matters. And I think if you take Western medicine by itself and just care, just the fertility care space or healthcare in general, we're getting away from that. It's the experience matters less. It's like getting people through. It's why people feel like a number in a lot of situations. Not every situation. I'm overgeneralizing, obviously. But the experience matters, and we should be paying attention to that. And I think this is an important piece of that.
It is. And that's how I've built Lillian Horn, both by volume in terms of it's primarily physician referrals and then word of mouth. But it's also how I've diversified what we offer, because after my own fertility experience, it was not as easy as I hoped it would be. And it was enormously stressful and anxiety provoking and fearful. And I didn't, I'd supported so many people through it, and I didn't really understand what that felt like until I was in it. And I was just like, holy cow, like, no, first of all, no one thing is going to help everyone. And we all deserve access to tools that will help us both, improve outcomes, but also improve our quality of life in the moment. And so, at Lillian Horn now, we have a whole team of reproductive mental health specialists for this reason, with the Cala Collective. And hopefully you're going to talk to one of them. Bhatia is amazing. But, I see firsthand patients can go through horrific experiences with IVF. And if they have the right care, especially the right therapist, or someone helping them through trauma, they come out the other side with success and they live their lives. But even people who have, in the grand scheme of the variety of what you can experience with this journey, maybe milder cases, if they don't have good care and good support, they can be traumatized. And even when they have their family, it's sometimes hard to come out of the muck of that, and you carry it around with you if you don't know how to process it and move on.
Yeah.
And I think that's the take home here of, like, you can't control the when and the how of how you're going to have your family, but if you have the right support and you learn how to navigate, you'll reach your goal. But you need to have the right people on your team to get there if it gets really intense, right?
Yeah.
I think you're talking about, like, there's this aspect of a little bit of personal growth in somebody navigating this journey, right? And it's almost like, if you don't have that support, we're kind of stunting that growth. And, I think no matter how easy someone's fertility journey is, it's not easy, right? It sucks across the board. But I think I saw something, I don't know, it was a couple months ago, on, like, there's actually, like, an additional stage of grief, which is really, like, learning and coming out on the other side and, like, putting that grief into, like, a proactive, thing that you do. And I think it's about that growth, and, like, how can we take that experience and look back at it and go, that sucked, but this is what I learned from it, and this is how I can apply that in tough situations going forward.
Exactly. Like, you build this resilience, and you're right. Like, no one wants to do it. I always call it the silver lining no one wanted. But if you have the right support, or even, like, some people do it on their own, where they just build this resilience and then they take it with them through parenting, through elderly parents or perimenopause, whatever it is where you're like not in control, that if you work on those skills, and we all get opportunities at different aspects of our life. Like, I have conversations all the time with patients who are, their best friend gets pregnant on the first try and they're like, that's so, it's like, okay, well, they didn't learn those lessons and that wasn't their time to learn those lessons, but we're all presented challenges in life. Cancer journeys. That's another reason I did the cancer supportive care training with Memorial Sloan Kettering, because it ends up kind of being a similar journey of like lack of control of outcomes.
Yeah.
You got to go through it to get to the other side, and quality of life in the moment can really make a difference. It's a different way of using the medicine, just like it is for IVF with acupuncture. But I like supporting people in those vulnerable states to, prop them up and remind them what badasses we are, and to just keep going and to learn new skills. It's like, I think of it as this operating system that we all have. And, as we navigate life, we adjust. But this can be such a big, big challenge that it's sometimes the biggest challenge a woman faces in her life. It's like maybe bigger challenges to come, but the first major one that really hits on all levels: physical, mental, emotional. And, it can be a huge opportunity for overcoming and learning and upgrading that operating system so that when you come out of it, you have this whole new perspective, and it can be filled with gratitude, but there's also often grief, and learning how to hold space for both. And it gives you a different way to navigate life thereafter, I think.
Yeah. I mean, I love what you just said about all the things that come after, right? Fertility is just one part of the journey. The worrying, I think I've worked with a lot of patients, and I'm sure you both see this too, where it's like they think the worrying will stop once they're pregnant, right? I just need to get to that point. Yeah. But then it's like the milestone, the benchmark just keeps moving further and further. Well, I just need to get through the first trimester. Well, now I just need to get through the delivery. Well, now I just need to get through this first year of life with my baby, right? And it's never easy. I mean, my son is 10. I went through my fertility journey. It's still not easy. Like every day I am.
And I am anxious every day about him.
Absolutely. Yeah. It just, so I think, I mean, I think it's the silver lining, as you said, no one wanted, but learning those skills and being supported and working through that will only make you better as that bar keeps moving further and further.
Yeah. I like to remind patients that, especially women, that we all have this well of strength within us that we kind of don't know about until we have to dip in. And I think patients who don't struggle to get pregnant often have to dip in postpartum or early parenting, because it's tough too. But if you've already had to find that well, it's like, it almost feels endless. Like it's just, we never know how hard we're going to have to try or what we're going to have to go through. But knowing that well is there, and, most of my patients never even find the bottom. They just keep dipping and dipping and dipping and dipping until they get there. And it's like knowing you have that strength. It's such an asset, I think.
Yeah. So. Yeah. And I think how the experience is for you is how deep you have to go into that well, right? And I think the ultimate goal for all of us practitioners in this space, the goal should be to not have them have to dip in quite so much, right? Yes, having that support system, having, all these different avenues and this integration of support, we can keep people from not having to dip quite so much into there. And that experience, again, can very much just shape what happens next. And the like less traumatizing and all those things we keep talking about. I love this. I would love to shift gears really quickly because I want to get to acupuncture because I want, because I think there's so much misinformation out there. There's so many people that are trying to sell you things and do these things and all these things. And I would love to hear from somebody that approaches it from a very evidence-based perspective. So, and I don't think a lot of people understand maybe how acupuncture works, right? And I actually went to acupuncture a few months ago for migraines and some other stuff. And I specifically had her describe this to me, why are you picking this spot for this and this and this? And we don't have to go down that rabbit hole, but I just found it fascinating. I totally geeked out. But could you oversimplify acupuncture for fertility for our listeners? Why is it evidence-based? What is it doing? Things that you would want our listeners to know of, this is why this exists. This is why it's helpful. And this is why it's been around for so long. and has found, supports this community.
Yeah. I think I have so many things to say about this, obviously, but the take home is we're still understanding from a biomedicine point of view how acupuncture works. And there's always new things coming out of, recently they found this whole new like little lymphatic system, something like the lymphatic system that engages with all the acupuncture points, but we had never even understood because it goes away when you cut the skin. Did you guys read about that? It's like,
No.
it's, yeah. So, I mean, there's like, we're always learning these new things. And, I think it really also depends on what you're working on. But at its core, I think of acupuncture as a signaling mechanism. Our body is constantly, has sensors and is sending its own signals and is responding to its environment and is trying to maintain homeostasis and, deal with stress and so many things. Acupuncture is signaling your body to change in specific ways, but it engages the blood flow, the lymphatic flow, um, neurons, muscle tensils, like whether they're relaxed or tense. It's breaking up scar tissue. It's affecting pain receptors. Like there's so many ways that acupuncture has an impact, and it really depends on what you're working on. And so I think of, in Chinese medical theory, we're correcting and balancing the flow of energy and the meridians that all integrate into your internal organs. And so that was the Chinese medical theory is that acupuncture points kind of help correct the flow of qi along these meridians. But I think of it more like communicating with your body. So when I sit down with a patient and I see them for the first time, we do this huge long intake. Obviously, if I'm working on fertility, it's a lot about the menstrual cycle, any blood work they've had, any scans they've had, testing, biopsies, anything like that. But we're also going to talk about digestion, sleep, energy levels, mood, lung health, immune health, digestive, like cardiovascular health, like all organ systems we talk about. And I look for variations in how a patient's presenting that information, and it helps me understand the underlying Chinese medical diagnosis, which is a pattern. And so in Chinese medicine, we use patterns to describe dysfunction in the entire body instead of just one area. So I never diagnose just the ovaries or just the uterus. I'm diagnosing the whole system, and I'm using my tools, acupuncture, Chinese herbs, diet changes to help correct that entire pattern, which is why I can work on simultaneously IBS and fertility at the same time. And so, there are a lot of studies now that show acupuncture is beneficial for many things. But I also want to point out that acupuncture is incredibly hard to study in a double-blind placebo-controlled trial, which is the gold standard of science, because you would have to blind the patient, you'd have to blind the practitioner, and really acupuncture excels when it's customized. And so
Right.
no one treatment or one point combination is going to help everyone. Even still, when we do that, it helps a lot of people. Like for embryo transfers, there's a lot of trials that look at people who use acupuncture for before and after embryo transfers and people who don't. And the people who are using acupuncture tend to have better implantation rates. But really, my favorite study when it comes to looking at acupuncture in Chinese medicine and fertility, especially IVF, was done by my friend Lee Hollander Rubin. And she tracked patients who included acupuncture, working with an acupuncturist in the month leading up to and including an IVF cycle. And those patients had better live birth rates compared to people who did not work with an acupuncturist. And I think that's really important to distinguish because our ultimate goal is not getting a positive pregnancy, but actually having a live birth. And all the things we do to help a patient in the lead up, like ideally you would work with an acupuncturist at least 2 months before an IVF cycle, but sometimes I don't have that time and the RE's on, a tight schedule. They're already committed and we do what we can in the time we're given. And again, nobody has control. And so, sometimes that's enough and a patient has success. But the work we do in those months helps optimize your whole health and your body chemistry in a way that, improves live birth rates and helps people have a healthier pregnancy, hopefully.
Oh. I want to learn.
It is
honestly,
so fascinating.
It's fascinating. I mean, I think actually you just said too, like you went to an appointment and you were like, I think I'm the type of person too. I want to know the whys. Like tell me like the systems and how it all works together in the pathophysiology. So I find this is all so fascinating.
It is fascinating. It's also confusing when you try to look side by side with the Western medicine. So because of my background and because I have chosen to really work within the Western medical community, I tend not to talk about qi and blood and yin and yang. When I'm describing our goals with a patient, I'll say, okay, well, you have this history of Asherman's. As you're going through, like maybe you do a surgery for the Asherman's, come to me immediately as soon as you can. So we're going to work on increasing uterine blood flow as you're healing with, they're on estrogen. Maybe they have a balloon inside the uterus to help with healing and reduce adhesions, whatever. So I've really tried to learn how to talk about using my tools in a targeted way to support whatever they're going through from a Western perspective. But that being said, we support many people who don't need IVF, but I just sometimes here's the other thing. If I start to use the language of Chinese medicine, sometimes patients will latch onto it. Like, Laura, your excitement right now. Sometimes patients will be like, ooh, my doctor never talks about my yang. It's my yang deficiency. Why isn't my doctor looking at my kidneys? And it's like, okay, like this is just a language we use to organize the body in a way that allows us to pick the right tools, right? That's it.
Yeah.
And so it's not like, your doctor's not paying attention to your liver, and that's the real problem. Like, it just gets too confusing. And I feel like patients go down a wormhole where they're trying to figure out this whole new way their body works. And it's like, no, your body has this way of working. We're just using a different perspective to pick our tools.
I love that you just
See, I so much appreciate that, the way you speak to, it's sort of the same in Western medicine, right? Like doctors, you have all this knowledge. We can use all the big terms. We can use the acronyms. We can do this all day long. And it's confusing.
Yeah, so we confused a lot of our listeners, I think, with some of the terms that we use.
For sure,
it's because easy to do.
It's so easy. When you're in it, you understand it. But when you're talking to a patient, you need to be talking about it very simplistically. We're talking about blood flow to your uterus, and this is why, and blah, blah, blah. Like, if we could just all be better about describing things in a very plain language of this is essentially what we're doing. Yes, we know all the stuff in the background, but they don't need to know that. And again, I think that's part of that support that, and I just love that you actually do that, because I have met acupuncturists and it's no fault of them. Like that's what they do, and that's how they've trained, and that's, and so they use those terms.
So in love with the medicine. It's a beautiful medicine, but it's like, it can get really confusing.
Yeah. How do you think you've been able to, and maybe you don't know to answer this, maybe this is kind of out there a little bit, but like, how do you think you've been able to cross that barrier? And again, you've had a 20-year career. So I'm not saying that like this had happened. It was work and all the stuff you put into it. But like, how do we like cross that barrier and that collaboration with Eastern, Western medicine? It doesn't matter. Therapy, acupuncture, you name it. There's these, how do we web all of this together and all work together in that way? And I feel like you've done, again, I keep saying this, but like you've done such a great job of it. It's like, how do you think that you've had that success?
It was very on purpose. I was very determined to do this, and no one was really doing it when I started my career. But any opportunity I had in front of someone in the Western medical space, I would, try to talk about it in their language. And I would also write letters to physicians with the patient's permission. I would write a letter when I first saw them saying, hey, I'm seeing your patient, especially IVF doctors. Here's how I'm going to support them and use their language. I'm going to help support ovarian function in preparation for the IVF. Just so you know, I will never put your patient on supplements or herbs while they're doing treatments with you. If you want to discuss this case, please contact me. The patient's given us permission to chat. And I just would like pepper the city with that. And eventually, I think doctors started to notice, oh, she said she was going to do this, and look, this patient did better this cycle. And so then when another patient asked them, well, I'm thinking about acupuncture, they would be like, oh, go see this woman. And then so they might have a case that was like really complicated and wanted to chat with me. And so eventually I started having doctors reach out and say, let's, thank you for this letter and thank you for supporting this patient. I'd love to learn more. And so I just over time started to gain the trust of doctors that way by really clearly stating how I thought I could help, and then doing that. And then, having the patient, maybe the doctors were like, hey, how's it going? Like, how's it going with acupuncture? And, usually patients, there's the aspect of improving outcomes, but there's also reducing stress throughout the treatments and, improving quality of life and lift the burden of, sometimes like patients end up crying during the session and they're like processing the whole experience, and that eases the whole experience. So I think physicians took notice, and because I was so pro Western medicine, whereas a lot of times some acupuncturists are like, you don't need to do IVF, like just do my program, or, work with me for 3 months and you can get pregnant naturally, which now drives me bonkers, because if you're 38, you may not need to do IVF to have this baby, but maybe you want more than one, or maybe you want 2 or 3 kids. And if you do an IVF cycle, especially after a couple of months working with an acupuncturist, you can, it's fertility preservation to bank embryos and then use them at a later date for a subsequent child. So I see so clearly the benefit of that integrative approach that I have worked really hard to gain the trust of physicians. And also, when I got invited to work on site at CCRM, which I've been doing for the past 10 years, I learned so much just by the generosity of those doctors being willing to answer my questions. I'd be like, knock, knock, can you tell me about this drug? Or like, I've just been so thirsty to understand all aspects of it so that I can understand where and when to use my tools. We were not taught this in acupuncture school, like how to, help someone through IVF. It's its own little ball of wax. And so I really had to teach myself. And then it's always evolving too. There's always new treatments coming out. There's always new biopsies, stuff like that. But I'm always thinking about how can I, like what tool would work best for this from my arsenal. And I'm always looking for more tools too, right? We're always evolving.
I love this analogy of tools, right? Like we all don't have all the tools. I think going back to what I was saying earlier, we all don't have all the knowledge. We all have our own respective tools. If we put them together, again, it just leads to the best possible outcome. And clearly, like through this work that you've done in gaining trust, like maybe it's not your double-blind placebo, study, right? But you've shown through your work with patients and passing that knowledge along to the physicians, like you've shown the proof of what you're doing and how it is improving the patient experience and the patient outcomes. And I think that's like super powerful.
I think patients feel this too, like down the downstream, right? I think because there is this sort of Eastern versus Western medicine, us versus them sort of thing. If you hear your doctor, you tell them, oh, I started acupuncture, and they're like, oh, okay, or you hear your acupuncture say exactly, oh, you don't need to do IVF, or, oh, don't go to that doctor. It's this, again, this like sort of battle, and that trickles down to the patient. They feel like they're doing something wrong. They're in the right place. They're, insert X.
Yeah, exactly.
Yeah, like who do you trust at that point? And I think those start to be really big red flags for me, right? If you're talking so poorly about X, Y, and Z, I personally don't want to be going to that individual or person as I'm navigating something very overwhelming and stressful and personal. If I'm trying to better myself by doing X, Y, and Z, and then I'm hearing this negative whatever. So I think it trickles to, I don't think we realize it as much, but that absolutely trickles down to the patient when
it's a burden. To try and figure out the truth. And the reality is like, we don't know what's going to help.
That's what I was just thinking.
But we do know there are harmful things, and we do know there's a lot of misinformation and a lot of fear mongering to sell things. Yes. And I think that's what's happening, especially on social media, that's just really angering physicians, rightly so. And so I'm really, I don't love being on camera, but I'm, we all have to get out there and get good information out there. That's not just trying to sell something, but actually just trying to empower and educate people as they're trying to navigate this. Cause it's such a vulnerable experience. Like I am friends with a reproductive endocrinologist who was going through her fertility journey using IVF when I was, and she texted me one day and was like, she had just had a transfer. She's like, Mary, I'm Googling symptoms. Like the doctor was Googling symptoms because when we're in it, we're just a patient and it's so overwhelming. There were days I was like crying in a ball in an empty treatment room, and just, it's so vulnerable, and you become open to like, well, maybe I should drink dirt water. Like, maybe, like just like
that's a new one
is out there. That's like these crazy, cleanses and things like that. And it's like, it's really, hard to know who to trust. But when you have your doctor and, when you have that integrative approach and the team is working together, then you don't have to worry about that. It's like,
Yeah.
I trust these people. They're on my team. They're on my side.
Yeah.
And the burden is off the patient. And
Yeah.
the practitioners trust each other. It's like it's so much smoother and for everyone and more effective. I think.
There's enough to worry about versus having to worry about, what to trust, who to trust, where to go.
That's why I love these conversations so much, because as you said, I mean, there's so many people out there. We've talked about this on the podcast numerous times, trying to sell people a solution. And unfortunately, for those of us who want to do good by patients but don't like social media, we have to do it, right? Because we have to raise our voices above that to try to get the right information to these patients.
Absolutely.
And it's so tricky. And I think I think any side, right, Eastern or Western, that speaks in absolutes, right? It's absolutely just this or it's absolutely just that, should be a red flag. Like, I am all about, I mean, if we want to pretend, let's pretend for a second that both sides are, let's pretend for a second the acupuncture does nothing, right? Let's just pretend it does nothing. It still did something for that patient in giving them some control and giving them an outlet during a very difficult process, and vice versa, right? Let's pretend that a patient did an IUI cycle coupled with acupuncture. They got pregnant with the IUI. Maybe it wasn't the IUI. Maybe they just got pregnant that month because they had sex at the right time and it was that sperm that met up with the egg. Like, as you said before, we don't know. But I think working in tandem, we're not doing harm unless we're speaking in these absolutes. That is absolutely harmful.
I agree. And I think people are only doing that, either they're not knowledgeable. Like, there are all the time, I know some doctors who are like, oh, acupuncture doesn't really do anything, but if it helps you relax, it's fine. It's like, it's not that they, are, being negative or mean. It's like they just aren't aware of the current research. Like, doctors don't know everything. They can't know everything. They can't know. They're not a nutritionist. Like, they know what they know. They know their tools. They're going to do what they know works. But I think, especially as we all navigate our careers, hopefully treating fertility is very humbling, in my opinion. And I've, as I've navigated my career, just gotten more and more open, and, not thinking I know everything. And hopefully good providers in any industry move in that direction as they go through their career, instead of thinking they're God and they can do everything. I think those are the practitioners where it's like, okay, well, you're either an amateur or you're lying, because no one is in full control here. And I think you just, you have to keep going until you reach your goal or pivot. And, having, the right team just makes such a difference.
Yeah.
Well, and I think having that hunger for learning too. Sorry, Ashley, I didn't mean to cut you off. I think having that hunger to continue to learn, like you said, you were already successfully doing acupuncture for CCRM patients, but you were still bobbing your head in the office and be like, hey, can you tell me about this? Right? Because that's going to make you better. It's going to improve the skills and the tools that you already have. I think that's what we should all be doing. We should all be learning from each other, because we all have unique things to bring to the table.
Right. And really honest people in this industry know that their tools are not enough, and that no one thing will help everyone, and there's no guarantee. And so the more, I think, evidence, I'm so relieved. When I first started my career, there wasn't that much evidence for acupuncture. And so it was a little bit of a leap of faith to go into it. But I was so, just kind of fell in love with the way it was practiced and the theory behind it. But I think, using evidence-based tools, even if there's a little evidence, it can be really helpful, rather than, whatever your favorite influencer is saying about their program or tools.
Yeah, I think it's interesting too, because we've talked about this a lot, is research is always evolving. And I think you mentioned it a little bit earlier in the podcast, right? Like, we're constantly learning more. We're constantly like moving forward. And we actually we did another podcast episode where we talked about the history over the last 40 years, the evolution of fertility in general, and doing things now that we never thought we would do 40 years ago. And there's going to be things 40 years down the road that we never thought we would do, right? Because we're working with the evidence we have now. And
Exactly.
so it's really interesting, right? It's like we need to be continually doing evidence. We need to be continually asking questions. We shouldn't just be so like negative and poo poo on certain things, especially if it's not harmful, until we know is what is it doing for us? Is it evidence based? Does it have a little bit of right? Like
Yeah.
it's
Yeah.
constantly changing, and
Constantly changing. You're
we
right.
should be paying attention to that and being open to having those conversations instead of just
Yeah.
like, that's not what I've done in my 30-year practice, my 20-year practice. So
Right.
I'm not going to do that because
Right.
I haven't done that before, right?
Right.
It's
Exactly.
the I think the best practitioners and people in the space are the ones that are ever evolving, using the tools that they have, using the knowledge that they have, giving best patient care and evidence-based medicine in that scenario, but then constantly like, okay, we need to be paying attention, reading articles, having conversations. And I think that's where we end up giving the best possible outcomes for our patients.
Yeah. And then I think the noticing things, like I was listening to an influencer the other day who, we probably all know what we're going to talk about, but the noticing something in practice that doesn't yet have a lot of clinical evidence.
Yeah.
And there's like this big war happening of like, oh, we shouldn't be talking about things that there's no evidence. And it's like, well, sometimes we notice something and then we build a study to gather evidence to see if it's a thing. And that's just how science works.
Right.
You can have anecdotal evidence, which is just like, oh, I'm noticing these things, I'm seeing it clinically. And then science, the way we work, right, is the scientific method. You form a hypothesis, you design a study to test that hypothesis and see if it's really a thing. And then you run statistics to see if there's significance. But in order to look at something, we have to notice first. And so I think it behooves us also to not ignore things we notice, to get curious and to stay curious, both for learning new things, but also to being open to, moving the eye of science onto things. Like, oftentimes in science, the things that get looked at are funded by profit, like what's going to make money, right? It's not always clinically driven based on what we're just noticing. Sometimes it is, but it depends on, it's an involved process and it costs money to run a trial. And so, I think we're at that point where I think AI is going to start to come into this. And, as there's still some independent IVF clinics that are kind of doing their own trials just based on their own curiosity too. So there's, science is very, I have like a love. I mostly love science. I come from a science. My mom was a biology teacher. We're a very science geeky family, but I do understand the limitations of it too. So I think, especially doing the work I do, it's, there is some evidence, but it's not so overwhelming that every doctor's like, oh my God, everyone should be working with an acupuncturist, right? So we're not quite there yet.
And I think too, it's something we say a lot. And yes, fertility and medicine, Western medicine, is very much science-based for the most part. But I think fertility specifically, we've said this a lot, it's an art form. It is art, right?
For sure.
And one thing for one patient's going to work something completely different for another patient with the same exact diagnosis. Treatment one way or protocols one way or doctor's preferences one way is going to work one way for one patient, one way for another patient. So it's very much as science plays into it, fertility specifically, and we could talk about other sciences, but fertility specifically, it's an art form. And that can be
Absolutely.
frustrating, but also, it's a double-edged sword a little bit. And I think paying attention to that is important.
Yeah. I see patients I work at CCRM, but I see patients from almost every IVF clinic in Manhattan, which is, I think, one of the most IVF clinic dense places in America.
Yeah.
And even the world. Like, we have people coming in from all over to cycle here, all over the world. And so I end up seeing, and part of how I've liked to work is to get to know how each doctor really likes to operate so I can support them. Like, that's really, I care about that. But I also see so many people doing different things and having different opinions on the same thing, and they're still getting results. They're just, it is an art form, and it's based on science. And as new research comes out, I see everyone experimenting with the new thing, the new method, the new test, whatever, but then they're all forming different opinions on it and their own way of using it or not using it. Like the receptiva test, like some people are like, absolutely not. And others are like using it all the time. And, and some people are doing the Lupron suppression and other people are just sending right for laparoscopic surgery for endometriosis. Like there's just such a diversion once a new piece of data comes out. So it is an art form and it's based on that physician's experience with the whole milieu of like what's out there. But most of them are getting results too. And so that's why it's like no one thing is going to help everyone.
Yeah.
Exactly. There's literally like if I could project my brain for a second, there's like little like lights and it's like fertility is not a linear journey, like all over the screen. Like literally that's just like, it's like I have this like comedic, when anybody on this podcast says anything in the realm that is along the lines of like, it's not the same for everyone. Like literally this just like image goes off in my head where I just want to like
really do need to get this tattoo.
I totally am. I
really
joked before
do.
we got on the podcast today that I was like, I need to get this tattooed somewhere on my body because it is my tagline.
It is your tagline.
I love it.
But it's so true.
Put it right
Let's talk. So there are a lot of people who are scared of needles. There are a lot of people that, they're spending a lot of money on fertility treatment. Unfortunately, that's a whole nother podcast episode talking about insurance and all that fun stuff that goes along with the fertility side of things. What is your sort of, I'm not 100% sure how to ask this question, but like, what is your sort of like feedback, I guess, to those people, or how do we navigate those sort of conversations of like, if somebody is super scared of needles, has a super needle phobia, do we still recommend acupuncture? If somebody, is super strapped on money and has no insurance support, like how do we sort of navigate that sort of those pieces of the conversation of the fertility journey that unfortunately we have to have?
Yeah, and there are realities for a lot of people. So let's start with the first one. I have a lot of needle phobic patients. There are very few patients who love needles unless they've had a lot of acupuncture before. And I will say when I went through my first egg retrieval, I'd been supporting people for 10 years doing this stuff. And I was like, oh my God, there's so many skin pricks between the injections and the blood draws and the acupuncture twice a week. I was like, I can't believe patients come to me for this. This is insane. But again, like struggling to conceive or wanting to freeze your eggs or whatever it is very motivating that we often get over things that we were kind of like holding us back before. So I have plenty of patients who are needle phobic. First of all, my philosophy for acupuncture is it doesn't have to hurt to work. There are some acupuncturists who think you need to like really crank on the acupuncture points to get it to work. I don't think you have to do that. I get good results without doing that. I'm very gentle. I don't want my patients to be uncomfortable. It's a grueling process as it is going through these fertility treatments. So I want this to be pleasant. So I make sure that my patients are comfortable once the needles are in, and most of the points you don't feel. If anything, there can be like a mild sensation, just like mosquito bite kind of first prick, and then it goes away immediately. It should not be lasting and uncomfortable. You should not be in pain during acupuncture. So that's just my philosophy, especially for fertility. I mean, maybe if you've like pulled your back and your back's spasming, but like even then I try to be gentle. And then once the needles are in, patients rest comfortably for about 30 minutes. We use red light therapy also, so that's very soothing and warm. And I give my patients a call button in case they need to talk to me while they're resting. So it's, a little, most of the time patients will get into a more relaxed state, and the acupuncture, anything we're doing during an acupuncture treatment, it doesn't matter what we're working on. The acupuncture helps shift the body out of that fight or flight state and more into what we call rest and digest, which is the parasympathetic state. Blood flow is automatically prioritized more to the reproductive organs during that nervous system state. And so people often fall asleep, especially if they're a little sleep deprived, haven't been sleeping well, or they kind of go in and out of the first stage of sleep where there's like lots of twitching and just like floating or feeling heavy, usually very pleasant. So after a couple sessions, I think people get over the needle phobic stuff. But sometimes I've had cases where it's like just not for them and they, pursue another modality, and that's fine. You gotta find what is right for you, what works for you. And then the cost, that is super valid. Like this stuff is all so expensive. I think in the cost comparison to like an IVF cycle versus incorporating acupuncture, like a full course of acupuncture to support an IVF cycle might be like, $1,500, $2,000 versus like $30,000 for an IVF. So I think like if, helping that one IVF cycle work better, that seems worth it if you have to pay out of pocket. There are acupuncturists that take insurance. My practice doesn't. We provide super bills to reimburse people because we are so specialized. A lot of a lot of insurance companies will cover things like back pain or headaches. And so, because we're working on everything in the body, sometimes we can, if we know that a patient gets coverage, we can kind of code it as that and also be working on those things. And so that's kind of a workaround. But I've also had cases where maybe a patient doesn't live close by, or they are so strapped and they go see an acupuncturist that's in network or closer to their area that's cheaper. And maybe they come see me once a month and we just do a check-in and I do the herbs and supplements and, do the kind of redirection of treatment if we need to. I can collaborate with other acupuncturists. I don't mind doing that. I'm always just like very focused on my patient's experience and outcomes. It doesn't have to be me, but I think having access to it is better than not. And so I'd rather a patient, getting acupuncture, if you're going to commit to it, it's better to do it on the regular rather than just like a one-off. Aside from like embryo transfer, if you're only going to do a couple sessions during a whole IVF journey, maybe the embryo transfer is important before and after, unless you're struggling to make healthy embryos, and then you may need a little more work before the retrieval. But really it's that full, like, remember we talked about like the live birth rates is really the goal. Mm-hmm. And it's that work. It's a little like going to the gym or working out, where it's the regularity with which you do it that elicits lasting change, rather than just like going to the gym one day, it feels great afterwards, but it's not really going to change your body if you want to change your body. Right.
Yeah.
Yeah. I had a point and it's gone.
I'm going to take a sip of water while you're
Please do. Mini break. We could insert some music here, like as I'm thinking.
I wish insurance companies covered it more. Insurance companies often don't cover acupuncture, especially for fertility. Yeah. And so it's extremely frustrating. And I'm hoping that as we expand access to IVF, like the government's trying to do, and, there is a push, especially we just had the lowest live birth rate on record last year, that we will be open and insurance will be open to covering more of these treatments that help improve outcomes.
Yeah.
Thinking of like this, Ashley, you got your thought back. I'm going to let you.
I did get my thought. No, I was just going to say that I think we've said this before too, like there are, and just alluding back to what you said, like you want your patients to be very comfortable. Acupuncture should be a relaxing experience and things like that. I think some things that we've said before, like there are good doctors, there are bad doctors. There are good nurses, there are bad nurses. There are good acupuncturists and there are bad acupuncturists. So I think, to listeners who are trying to, and like, I tried it, I had a terrible experience, I'm never doing that again. But you're still on your journey, or you would like to try it again, and you're hearing all of this, like you aren't stuck with where you went before. Your experience should be a certain way. You can try other places and things like that. So I think that's super important, no matter where you are. Doctors, doesn't matter what you're doing. There are other options for you, and it's not a bad thing to get the experience you deserve, and the best outcomes possible out of it. So that was going to be my point to your point about comfortability during the process.
I get that all the time. People are like, oh, I had a bad experience with acupuncture, but my doctor said to go here. I get that a lot. And then hopefully, they tend to have a better experience of just a more pleasant, less painful experience. Yeah.
I've been thinking about this like utopia as we've been talking, right? Wouldn't it be great at some point if we had, clinics that incorporated all of these things as part of treatment, right? You had acupuncture, you had mental health, you had the clinic, you had a coach, you had all the things bucketed into one place. How wonderful that would be.
I think we're going to get there, honestly, just the way that I've seen it evolve. I might say something controversial right now, but there are a lot more women in reproductive medicine now than, especially when I started my career. Most clinics were all men. I love dude doctors, don't get me wrong, but men tend to be really focused on outcomes, whereas I think women in general are also focused on the patient experience and especially stress levels and emotional regulation and things like that. And a lot of the doctors, I collaborate frequently with male doctors too, but a lot of them that I like regularly, with the patient's permission, collaborate on care. It's female doctors who want that integration and want to make sure that their patients have all aspects covered, and they're not just thinking about what they're doing, right? And thinking their tools are going to solve everything. And so I think we are moving in that direction. And Dr. Tlaman and Dr. Notman and I have like always fantasized about having a space together. They were,
Yeah.
using my clinic for a little bit, doing initial intakes. I think we'll get there. I think parts of the country are already trying to do that. It's like a logistics thing. CCRM is one of the only clinics in Manhattan that has acupuncturists on site. Like it's already starting to happen. We just have to push for it, I think. And patients, I think, voicing their desire for that is a way to elicit change as well.
Yeah, as you were saying this, it's like I do think patients are getting louder about the experience piece, which I know we've talked about, right? The experience is part of the process. And I think patients are getting louder about it. And I think, if we say anything good about social media, other than putting better information out there than that's out there, patients are getting louder about it. They're speaking up. And then they're hearing other patients talk about their experience through social media. So like this community aspect that social media creates and other communities out there, that's a positive of it, because I think because fertility feels so isolating sometimes and not a lot of people talk about it necessarily, but when you see other people like, I had this experience, blah blah blah, it was terrible, or this experience was really good, whatever the situation may be, you're like, oh, it's not just me that's not having a great experience here. And
Right.
if I talk about it, then so I agree with you. I think on the positive side of social media a little bit and just what's out there, like I think people having these conversations and actually, it's one thing for us to say it as practitioners slash patients in our own right, but because we're inside of it, it's easy for us to say that. But for patients, like people will start to listen to patients eventually more and more, right? Like they are the consumers. They are the people that we need to be supporting. And so I agree with you. I think the more we get loud about it, the more we talk about it, the more patients talk about it. I think hopefully we'll slowly see that change.
I trust that we will. I also think there's a responsibility on the wellness community part to want to be integrative and not to want to be our tools are better.
Yeah.
That's not collaborative, and it's not going to get us to that place where we're trusting each other, and really focused on the patient. So I think, I am very driven to have that voice and perspective, and I hope more people will just join in with that as well.
Absolutely. Well, on that note, we're bumping up on time, but I would love to give you an opportunity to tell our listeners a little bit more about Lillian Horn and how to get in touch with you if they're in the Manhattan area, etc.
Great. Lillian Horn is in Chelsea in New York City on 26th and 6th. We are a group of providers that share space, and there are 3 acupuncturists, myself included. We're all doctors of acupuncture and Chinese medicine. There's a naturopath, a nutritionist, and a whole team of reproductive mental health specialists called the Kala Collective. And we all just kind of collaborate on patient care when the patients give us permission. And we also have 2 physicians now. They're internal medicine MDs. They're both double boarded in different parts of medicine as well. Dr. Summers is doing a therapy called somatic experiencing, which is helping a lot of our patients who have experienced trauma in their fertility journeys or previous pregnancies or loss. It's a little deeper. They often share patients with the Kala Collective to do a deeper treatment for nervous system regulation and integration after trauma. And Dr. Yadov is doing our perimenopause support. So she's doing hormone replacement therapy, some peptide injections like GLP-1s, NAD. We're actually doing a clinical trial pilot with NAD right now, looking at egg quality and getting some really interesting results. It's like too soon to talk about in terms of data and making claims, right? We're waiting for our data set to be big enough to make a claim, but so far it's looking promising. And so we have a proprietary protocol we're using. And we're also, most of our clinicians can also do telehealth. I can't do acupuncture telehealth, but I can meet with patients online to go over like nutrition, supplements, herbs, stuff like that. So we're really trying to change the narrative, even just at Lillian Horn, with how we work together, how we think together, how we trust each other to work on different parts of the fertility, or, we do fertility, pregnancy, postpartum, perimenopause. That's really our specialty, is like the full, range of reproductive experiences for women, especially. We do treat men as well, but we're very well known for supporting women through these experiences. We're just like ever evolving. I started my practice 10 years ago now. It was just Mary Sabo Acupuncture. I was just me. And it just kind of evolved over time to include these other practitioners that I mostly just wanted to share a space with and refer back and forth, patients, because I trusted them so much. And so it's been fun to build that team out and to have a community of like-minded physicians or providers from different areas of medicine.
Yeah, that's so cool. I'm jealous. I wish Lillian Horn was everywhere.
I know. I was
Me too.
Not just in New York.
Hoping, maybe one day.
Maybe one day. I would love that. So all of our guests, we give just the opportunity, like, what is your sort of final thought for our audience, or if there's one takeaway that you would like to share with our listeners in regards to what we're talking about today?
I think my biggest tip, for at least when I was navigating my own fertility journey, and this is something that I tell my patients as they're going through it, is you got to play it like a video game. Like, you got to play the screen you're on, because you can't play 10 screens ahead or 10 screens, like relive a screen you've already played. Like, you have to play the screen you're on. And once you complete that level, you see what pops up next. Like, there's always, especially in a fertility journey or a reproductive journey, there's all these steps, right? And once you complete that, you see what's available to you, and you check in with yourself, and usually the next step lights up, but not until we're ready to make that choice, right? And so part of how I like to help patients navigate, aside from using all my tools and everything, is to really help them one step at a time. It's easier said than done, because I was,
Sure.
There were times I was a hot mess during my journey. But remembering that, of like, you can't get 10 screens ahead. You'll drive yourself bonkers. You've got to play out where you are, see the resources available to you in that moment, try to optimize what you're in, and then trust yourself when you get to the next step that you're going to know what to do.
That is the coolest analogy I have ever heard.
Thanks,
I
guys.
absolutely love that. Again, my brain today, I'm like, there's Mario going down a pipe.
You can't, you just got to be in it. You just got to play that round.
Absolutely. That's awesome. Well, thank you so much. This was a absolutely fascinating and wonderful conversation.
Thank you. I enjoyed it. Thanks for having me on. You guys are amazing. I love what you're doing.
Thank you.
Thank you. Yeah, thank you so much, Mary, for being here and for having this conversation. I think so many people need to hear it, so can't wait for this to be out there. And so for our listeners, as always, like, subscribe, share. Please email us, reach out to us, comment. We would love to hear from all of you. If you have any questions for us or Mary, we can get that to her as well. But yeah, thank you so much, Mary. And to our listeners, we will see you next week.
We'll see you next week.
If this conversation resonated, like, comment, or subscribe, share, send us your questions. Nothing is off limits.
And wherever you are in your journey, know this: you deserve support that's real and human. Never forget to ask your questions, advocate louder, and remember, you're not crazy. Fertility is hard.
That's it for today's episode of Fertility Nurses Unfiltered. Thanks for spending your time with us today.
We'll see you next time.